So we have Nicole in for a checkup today. Hi Nicole, how you doing?
Fabulous.
And so can you just tell me a couple things real quick? What's today's date?
May 9th,
Okay, and the year?
2017.
Okay, and can you just tell me the president?
Trump.
Okay, I don't know why that's so
Oh.
Okay, so just making sure Nicole is oriented and to person, place, and time. She always knows her name. She's not giving me any strange answers, so I know that cognitive abilities are okay. And then, so while I'm doing that, when I walk in, I assess her skin. Can we just step back a little bit? Just a tad. Okay, just that way we're on the picture. But so when I come in, I see she's dressed nice. She doesn't look like she's disheveled or anything. Her skin tone, as you can see, it is equal on both sides. Looks like you got a little tan going.
Oh, yeah.
Nice. Been getting some vitamin D.
Mm-hmm.
Excellent.
That's the one.
All right. So her skin's tan. I would document it as pink though. I'll go down, see her legs, her skin tone on her legs. If you could just put them both to the side, it's equal there too. I won't make you take off your boots, but I'm sure your skin is fine there as well. So as we look at the skin, we're gonna feel it and just make sure it's not extra moisture or wet or anything, so it wants to be dry, intact. There's no lesions, there's no random scabs or raises, lumps, moles that weren't there before that are here now. And I'll just verify with Nicole, do you have any abnormal things that you have seen on your body recently?
No.
Okay, so you know that looks good. So then we'll start up at the top. We're going to start at her scalp. Dogs, can you scoot over a little bit, please? These will go. Go on. Thank you. Okay. So we'll start at her scalp, and we're just going to make sure nothing's tender. Is anything hurt? Let me know. We're going to look all around it, make sure there's no lesions, anything. Okay. No tenderness?
Nope.
Okay. And then we're going to go around to her ears, and I'm just going to work my way down. So I'm going to look at her ears. I'm going to look in, make sure that they're symmetrical. Remove your hair. Okay, there's no obstructions inside. I would use an ophthalmoscope to look inside, but I do not have one, so we're not going to do that. Can you just take your glasses off for me? And then we're going to look at her eyes. If you can just look at my nose, and we're just going to check and see that your pupils are reactive. Sorry, it was a little bright. Keep your glasses off for me real quick.
Okay.
Can you just follow the pen? And we're going to go. Good. And we're checking for her ocular motor skills. Okay, good. All right, and then can you just put your arms out?
I can put this back on.
Yes. Arms out and touch your nose. And touch your nose with the other hand. Excellent. Okay. All right, and then I'm just going to palpate your face a little bit. I'm not actually going to touch it very much, but tell me if anything. I'm actually checking your sinuses to see if there's any pressure in there. Anything? Okay, good. All right, so she's got no pressure in her face. Her eye movements are good. Can you just scrunch your face for me? Okay, excellent.
Is that what you mean?
That is what I mean. Checking your cranial nerve 8, I believe. So it works, so that's good. Oh, it's cranial nerve 5, I'm sorry. And 8. Oh, 7. 5 and 7. So while I looked at her eyes, I also looked at her eyelashes, saw that she didn't have any signs of hypothyroidism. All her eyelashes are there. Same with her eyebrows. She's not missing any or anything like that. So can you just open your mouth? And I'm going to inspect in her mouth. Say, ah. I'm going to make sure that the uvula, the uvula moves when she says ah. And I'm also going to make sure that the inside of her mouth is moist. And I would use a tongue depressor to depress her tongue, and while I examine her mouth, I'll go around her lips, and I would make sure I have gloves on while I do this also. So I would inspect her gums, mouth, tongue, make sure the uvula moves. Can you just stick your tongue out for me? And then I'll say ah again. And I'm going to make sure when she does that her tongue is the same on both sides. Sometimes it'll actually move over to one side if it's not correct. But yours looks good. Okay, so we'll keep moving forward. We did your eyes, we did Perla, we did ears. And then, so I'm going to step behind her now, and I will start to inspect the back of her neck. And then while I'm back here, also I will do the whisper test, and I will whisper in her right ear. Can you hear me?
Mhm.
She'll say yes, and then the next side. Good. So she passed the whisper test, and then while I'm back here, I'm just going to palpate one side of her neck at a time, and I'm going to palpate her thymus and down towards the trachea, and then make sure I don't feel any lumps or lymph nodes that are raised or swollen. Good. And she feels good. And I'm just going to palpate down her back as well while I'm here, and just make sure there's no swelling or tenderness anywhere. I'm going to tip you real quick. Okay, good. All right, excellent. Okay. So while we're doing the neck also, can you just move your neck from left to right and then in a circle around? Any pain?
No.
Any tenderness? No. Good. All right. And so now I'm going to palpate from the front as well, just to make sure I don't miss anything. And then, so I'm going to feel her carotid arteries and double check the thymus and the trachea positioning. I want to make sure that it's straight down on both sides. It's not veering off to one way or the other. Excellent. And no tenderness or anything while I did that?
No.
Okay, good. All right. So now we're going to work our way down. While I go down here, I'm going to feel her pulses at her radial brachial arteries. So I'm just going to feel for a pulse because we already checked. We already did your vital signs, so we know you have one, but I'm just going to double check and make sure. And I'll do this on both sides, but for the video purpose, I'm only going to do it on one. Okay, and then if you can just grab my fingers and give them a squeeze, both hands.
Oh.
Give them a squeeze as tight as you can. Ow!
Oh.
Joking. All right, so she has good strength on her hands while we did that. Also, while I do that, I could assess her skin as well. I can feel that it's warm. Hands are a little cold, but that's normal. Okay. So now we're gonna move down to her lungs. So I like to do the chest expansion first, just so that way I remember to do it. So I'm gonna put my hands on her chest and tell her to take a deep breath. And I can see my thumbs will open up, so I know her chest is expanding. And now I'm gonna listen to her lungs. This is clean, by the way.
I was just about to ask.
Okay. All right. So deep breath. Good. Deep breath. Okay. And deep breath. And deep breath. Good. Okay. So her lungs are clear in the front. I'm gonna check the back. And I'm just going to go across the back as well. I'm comparing side to side. Okay. And I would go skin to skin, but for the video purposes, we're going to keep Nicole shirt on. And then while I'm here, I'm going to listen to her heart too. Listen to the aortic arch here with the bell. Alright, so what I did was I listened to all areas of the heart while I did that, and I listened with the bell. Okay, so sounded good. She had no abnormal sounds of the heart, no murmurs or anything. So we're going to go down to... Sorry, the screen's gonna go out. I think it would keep recording. Alright, I just have to listen for roots on your carotid arteries real quick. Take a deep breath. Okay. Deep breath. Okay. Alright. So now we're gonna do we're gonna move down to the abdomen. You can keep your shirt on for now. I would inspect the abdomen first. Then I would auscultate it. So I'm gonna start with auscultating it because she would be laying down. I would be able to see it. Right now I can't. So if you could just put your legs flat, your feet flat. Thank you.
Mm-hmm.
So I'm gonna listen to each quadrant. I'm just gonna move along for video purposes. I would listen up to a minute to 5 minutes for it. Okay, so her bowel sounds are active, which is very good. And now we're gonna percuss the bowels. So with our finger, percuss.
What is that for?
It's to see if you have any gas pockets or hollow spots. You would hear them, especially if you go over the liver and stuff like that. They have certain tones that you need to listen for. So then we would palpate the abdomen. So this we would palpate for deep palpation would be for the liver, the spleen, and things like that, which Nicole really is not a fan of. So I'm just gonna do a light palpation right now and just make sure there's no tenderness or anything. And you'll do this last because you don't want the palpation to disrupt any of the bowels and cause them to be more active than they were at rest. So then we're going to keep going down. We're going to feel for pulses. We would do we're going to do your popliteal pulses here behind the kneecap. And we're going to feel for a pulse on each side. Good. And then we would go down to the ankle. And then the foot. Each side also. Make sure her pulses are there. She has boots on, so we can't feel them right now. But we would make them take her off. Make her take them off.
Oh.
Okay. And we would also palpate the lower extremities for any tenderness. She obviously does not have any now, though. So we're going to test for sensation. So you just close your eyes. Give me the back of your hand. And tell me what you feel. Is it dull, sharp, or
It's dull.
Dull or sharp? Yeah, I think I'll go with those two. Okay, good. All right, so her sensation is good. Palpate your thyroid. That's done. All right, so now we're gonna test to see if she has any flank pain. So we're gonna go down her back again, but go a little lower to the kidneys and see if anything is tender down here. Any tenderness?
No.
Okay. All right. So no tenderness on the kidneys. Do you have any problems going urinating? Anything? Okay. So that's good. So if you can stand up, can you stand on one foot? Okay. Stand on the other foot. Okay, and then I would make her walk on her heels and toes, but we're not going to do that, so you can actually sit back down.
My heels.
Yeah, like walk on your heels and then walk on your toes. Okay. And that's it. Thank you for watching. That wraps up the head to toe assessment.